The other thing is that when we apply sunscreen, one of the mistakes we often make is that we don't reapply it as often as needed.
Okay.
So if people really were using sunscreen before they go out and reapplying as needed, you actually do go through quite a bit. So maybe you're not using as much as you should if you're having a lot of expired product at the end of the year.
That's a good point.
The other nice little tidbit to know is that when the FDA approves products and gets an expiration date, at least this is true for medicines, I don't know about foods, but they're required, the companies that make them are required to prove that their product is still viable for 6 months after the expiration date.
Oh,
So that's a nice little handy thing to know.
sure.
So
Because if you can't run out before you go down to a warmer climate, unlike Minnesota, you know, you can take it with, but also just remember that you should probably buy the product again too. Just for
I
the
think another aspect of sun protection, not only sunscreen, a lot of times I think that's a good product, and we certainly encourage people, but it's also a nice supplement to also put on protective clothing. So caps, hats, broad brimmed hats, you know, and there's a lot of sun protective clothing that's very nice. It's convenient. You don't have to worry about missing a spot on your back, although the spray sunscreens can be quite nice now, but still you're supposed to rub those in, and that sometimes can be awkward in the back.
Sure, yeah.
the other thing with sunscreen is I just want to backtrack and make sure I don't sound like I'm recommending people go out routinely put 6-month-old sunscreen on.
No, not at all.
You know, if you're going to go through the trouble, you might as well have a product that's working, unless you just want to use it as a moisturizer. If you don't know how much protection you're going to get from that sunscreen, is it really worth your effort?
Yeah.
Might be better to go out and get one that's really more effective,
Sure.
doing the purpose that you want it to do.
Yeah,
So-
be proactive.
Yeah.
Exactly. You know, because you don't want to have to pay for it in years to come. You know,
Right.
You know, just take
Yeah.
the few minutes, buy the $6 product, and you know, then it'll save you the skin cancer in the future.
That's a really good way to look at
Yeah.
it. Yeah, exactly.
Okay.
Well, the precancerous lesions you were discussing that your husband had to experience to deal with.
Yeah, and that's not fun.
You know, and it's really nice to be able to attack those precancerous lesions before they go on to become skin cancers. And we have a lot of weapons now that we didn't have a few years ago.
Yes.
One of the ways we treat precancerous lesions are actinic keratosis. We call them 8Ks because it's such a mouthful. So we treat 8Ks, we can spray them with liquid nitrogen, or we can use some creams that people can put on at home. And there's two main types of creams that we use. One is a chemotherapy in a cream.
Oh.
And you put that on every day. So if you have a skin cancer here, you might choose to treat that spot or treat your whole face. Because oh, go ahead.
You said if you had a skin cancer there.
Oh, I'm in precancerous, thank you. Yeah. So statistically, if you have one precancerous lesion or one skin cancer, you are at much higher risk for having another. So
Right.
we often try to get people to do some of the preventive things too. So with this precancerous treatment of using this chemotherapy in a cream, it's a cream that you put on every day for 1 month to 2 months. We always have to warn people that they look a lot worse before they get better, though,
Yes.
because it is killing all those abnormal cells, and so they can end up with big sores all over. And spots kind of get red and light up that, you know, they didn't even know there was a problem.
Yeah.
But then when you stop, the skin heals, you've killed the bad cells, the good ones are the ones that left.
It's
that
like
are
getting
left.
baby skin all over your face
You know,
again.
yeah.
Yeah, because he actually did that while I was gone on
Yeah.
one of my trips.
Oh,
And then when I came back, he was so embarrassed, you know, because he had all those little scabs on his face. But then when I came back and he was healed, I went, it almost looked like he had a little bit,
Yeah.
you know, like a laser.
Yeah.
Because he
Peel.
looked, yeah, it looked so good. He looked all the baby skin, all the fresh skin on
Yeah,
his. It was
yeah.
really actually kind
and
of nice
it's really
looking.
a selective treatment too, because it's targeting the abnormal cells. It's leaving the healthy cells alone. I mean, that is a nice little bonus from getting that treatment, is that people's skin actually does look younger, and a lot
Yeah.
of that sun-damaged skin cells are gone.
Yeah, it really, he looked a lot younger too, you know, afterwards. And so, but, you know, and then, you know, there's also those people that, you know, love their sun worshipers. And so before they go to Mexico or go down to the warmer climates, they like to go into the tanning booths. And I know people, oh, I'm getting my vitamin D. You know, and I'm lacking vitamin D, but could you go ahead and talk to, you know, our viewers about them being safe, or, you know, maybe a little bit of preventative if they really need to go to the warmer climate so they
Sure.
don't burn?
Okay,
That's
maybe we
good.
can come back to the other treatments for the precancerous ones later. But
Oh, sure.
definitely. Do you want to talk about the tanning booths first? Or?
Sure. The getting a pre-tan, going to a tanning booth prior to going to a tropical environment really does not provide a significant amount of protection. It may provide a little bit of benefit, but if a person is just more cautious, making sure that they wear the sun protective clothing, try to minimize their exposure during the direct sun.
Mm-hmm. The 11 to 2
Exactly.
time.
And wearing some protective clothing. And I'll give an analogy. I, as a dermatology resident, did the pre-tanning, and I was very confident that I wouldn't get burned, and I went to a tropical climate and I got significantly burned.
Oh.
And so sometimes it can give a person an overconfidence that they are not going to get sunburn because they're not used to that significant change in the amount of ultraviolet light that they can get exposed to when they're gone elsewhere.
Oh, wow.
Tanning booths used to be controversial. Are they helpful or are they harmful? But recent studies have actually proved that tanning booths actually do increase the risk of skin cancers, and including melanoma. The World Health Organization has recently declared that tanning booths are a carcinogen.
Oh.
And it's known. It's not controversial anymore. There's several done studies to back that up. So you have to really think about what you're exposing yourself to.
Mm-hmm.
Sometimes tanning booths will try to defend their product by talking about how there's less chance of burning with their bulbs. And that is indicating that they're using a smaller concentration of UVB rays in there.
Mm-hmm.
Think about UVA as leading to the A for abnormal skin cells and aging. And UVB is the sunburn.
Oh,
so
okay.
if they're having a smaller concentration of UVB, they're having a greater concentration of UVA. And so they're actually increasing your risk of skin cancer by the tanning as well.
Okay.
So the other thing is the bulbs aren't really very well regulated, and so depending on how well maintained stores or businesses are, you could be getting a huge amount one visit and a smaller amount the next, and it's really hard to know.
Yeah.
So.
And so when she said about UVA having to increase aging, so the UVA wavelength penetrates deeper into the skin, and so you get more wrinkles and irregular pigmentation with the deeper penetration. So you age more versus the burn more, which is the more short-term destruction of the skin.
Yeah, so we can just see the tan on our face, that our face gets, but it actually goes deeper into our pigmentation.
Yeah, those rays penetrate much deeper and damage the DNA. I tell my patients that if they want that color, I mean, we still are still a culture that thinks that the tan skin is a healthy look, even though now we're knowing it's really not a healthy look. But there's so many good self-tanners out there. There's spray tans. You don't really need to do that to have that look, if it's the look you want.
Yeah, and I know, as where we come from, if we're Swedish, or it's kind of funny how those who have red hair, they're fairer skinned than others, and our whole ethnic background's a little bit too, that how long we can be out in the sun, and my husband being red hair, so very fair, and my daughter is very fair maiden, and she tries to get a little bit tan, whereas my pigment, I just have to go out into the sun for just a short amount of time, and I go into a darker tan and look, with my skin pigment. And so it's kind of funny how even our backgrounds from what we're used to, like the blue eyes are more sensitive to light than brown eyes. So we have to look at our individual, skins and be forewarned a little bit about that.